Welcome to the National Rural Health Executive Webinar Series. My name is Colleen Bay with NRHA Services Corps, and we appreciate your time today. I have just a couple of housekeeping notes to review. Everyone will be muted during the duration of the webinar. Should you have a question for the presenter at any time, just go ahead and type it into your GoToWebinar control panel, and I'll make sure that it gets covered at the very end. We like to try to get through our presentations in about 45 minutes, offering some time at the very end for Q&A. As a reminder, this activity is being recorded and you will receive a link to the recording before the end of the day. Today, we have one presenter, Beth Brand. Beth has over 30 years of invaluable experience in the healthcare industry that ranges from critical care nursing, clinical informatics, and decision support to product expertise. At MoreCare, she provides extensive leadership and guidance to both customers and to the MoreCare team. Prior to joining MoreCare, Beth was a longtime customer at Indiana University Health, where she was the Director of Clinical Decision Support for the health system. I would also like to take this opportunity to thank our partner, MoreCare, for taking the time to put this presentation together. MoreCare entered the NRHA Partnership Program in 2019, and we appreciate their support of our mission and for the industry expertise they bring to our rural hospitals and clinics. NRHA partners like MoreCare play a significant role in supporting NRHA efforts on Capitol Hill and allowing us to put on educational conferences specific to rural healthcare. With that, I'm now going to turn over to Beth for our feature presentation, Creating a Recipe for Success, Key Ingredients for Denial Management in Rural Healthcare. Beth?
Thank you so much, Colleen, and welcome everyone. We really appreciate the fact that you all are choosing to spend some of your time with us today. And this is our agenda for this session. We're going to start by setting the stage with a brief overview of the impact of denials to your organization, followed by a recommended process for tracking and utilizing information which will enable your organization to make informed decisions regarding process changes and improvements that might be needed. And then we'll share with you how an automated solution can provide value to your organization in denials management. First of all, we're going to start and take a brief moment here for a poll. The question we're asking you is, are you currently receiving meaningful and insightful information from your organization about your denials? Colleen is going to launch the poll, and she'll let us know when it's ready to close, and also she'll read to us the results.
Thanks, Beth. I do have that poll up right now. So I'll leave it up here for a few seconds to make sure that everyone gets a chance to participate. All right, I'm going to close it in 5, 4, 3, 2, 1. And let's see what we landed at. Okay, so we have 52% with yes and 48% with no. It's almost right down the middle.
It is. That's very interesting. Okay, great. Well, thank you. And thanks everybody for taking the time to share that information with us. Well, as I'm sure that most of you all are just all too aware, there are many factors that contribute to the financial struggles in rural hospitals today. A combination of demographic, economic, and technology factors cause many rural hospitals to struggle. Not the least of these is the increasingly complex needs of the patient populations that these hospitals serve. Traditionally, we find that rural populations tend to be socioeconomically disadvantaged, especially in comparison to more urban populations. Rural patients often experience numerous health disparities and poorer outcomes than those served by urban hospitals. And another key contributor that people don't think about sometimes is the payer mix. Rural hospitals deal with a larger percentage of Medicare and Medicaid patients. In some instances, this can be as much as 2/3 of their overall patient population being government insured. This is an issue not only because reimbursement is often lower from these payers, and actually in many cases, the reimbursement doesn't even cover the cost of the care, but also signifies a greater burden in that these hospitals must respond and react to the ever-changing government payment requirements. All of these constraints make it difficult for rural hospitals to improve their financial position, and I'm sure that this is something with which many of you all are very familiar. Going hand in hand with this is the fact that claims continue to become more complex. We have aging populations with more needs, we have more complicated clinical scenarios, and then we also have the need to transition patients across multiple settings. I'm sure these have been pain points for many of you. And actually, truly, at this point in time, survival is one of the major challenges facing rural healthcare. Now, more than ever, rural hospitals are being pressured to address denials. Claims denials pose a very serious challenge. The latest statistics show that both commercial and public payers are now denying anywhere from 10 to 40% of submitted claims. Those are big numbers, and denials can cost health systems up to 2% of their net revenue. Denials are very costly to appeal. Again, a recent study showed that it costs approximately $118 per claim to work denials. And if you stop and think about how many claims your organization processes, and then wonder, what does that figure look like in a month, in a year? And what I'd like to do next is show you an example of how that can really add up. Let's think about the statistics that we just reviewed and how those translate to your bottom line. Assume that, according to those statistics, your payers are denying approximately 20% of the claims that you submit. And if we assume that the cost to work each of those denials is approximately $118, and if a hospital submits, let's say, 7,000 claims in a year, 20% of those being denied would be 1,400 denials each year. And if we cost that out at $118 per denial, that very quickly adds up to $165,200. Think of how this added cost is impacting your bottom line. We've talked about how denials create significant challenges for maximizing revenue. It is true that many hospitals are still using outdated processes or paper-based workflows for denials management. But given the fact that denials are on the rise, it's really important to have the right tools and processes in place. Technology can play a key role in curbing the denials issue and not only managing the denials process, but in truly avoiding denials from occurring in the first place. Think about how many additional hours are required by employees to resubmit and work denied claims, especially if they are resubmitting through a manual or outdated process. Well, this might seem overwhelming, but it is possible to make improvements. Key factors are to identify root causes and then having the commitment or making the commitment to actually utilize information and make change. The hospital revenue cycle is very complex. Effectively managing it requires transparency and constant communication between multiple departments. This is a high-level view of what your denials management process could look like by utilizing an automated denials management solution. First of all, track all denials, everything, all denials. Second of all, capture consistent data. It's very important to capture the payer involved in the denial, and then also to identify and outline the denial types and then specific reasons that you want to capture. You want to be thoughtful as you assign these to the denials so that the information can point you in the right direction when you aggregate and look back over time. We can't chase after every single occurrence, so put your efforts towards those with the highest volume and the highest cost to your organization. And then, above all, treat the root cause. If the problem is that you're not capturing registration information, for example, the appropriate registration information, then add required fields in the registration process. Or if the fields are there but they're not required, make them required. Add billing edits, add system holes to prevent incomplete claims, etc. In a recent nationwide study, Change Health conducted an analysis of claims from approximately 700 hospitals, accounting for more than $1.8 trillion in denials. And their analysis identified these reasons that you see listed here along this vertical axis as being the most common causes for claims denials in hospitals. And I have to tell you that from our experience here at MoreCare and in our work with customers in denials management, these are very representative. We feel that this is a good example. So this report, when you glance at it, might look like something that you currently receive from your rev cycle department. And you might be asking, so what? How do I use this? How can I take this and utilize this to make change? Well, the first step is to understand these different denial reasons and to identify where they are originating. This will allow you to focus on the teams and the processes that are at the bottom of each of these different issues. So start by grouping or categorizing your denial reasons into the phases of a patient encounter, because different tasks are being done by different teams at different phases along the way, right? So to start with, we will look at prior to service, the things that are occurring, the steps that are occurring that are leading to denials that are actually before the patient ever arrives. And you'll see that those actually account for approximately 50% of this sample data provided. So the areas are usually focused around pre-registration, registration, and eligibility. And again, with registration data quality, hospitals should examine the registration data and ensure that it's being captured accurately, consistently, and completely. If you can, put alerts in place to identify any potential gaps in the data and establish workflows to correct errors in real time so that you have a feedback mechanism, so that if data is left out, it's quickly caught and you're able to complete that data before we get to the point where you're dropping a claim. Eligibility. Registration and eligibility account for approximately 24% of all denials in the United States. And so ask yourself these questions. Is eligibility being checked consistently? Is it checked often during the stay? What processes are in place to deal with patients who are not eligible or don't have coverage? The second phase then is during the service. And you can see that these denial reasons that are associated with during the service account for approximately 22% of our denials here. So questions to ask: do you have appropriate medical necessity rules in place? Is education being provided to physicians on documentation issues that lead to denials? Are medical directors being involved when peer-to-peer is needed? So drilling in and understanding, pardon me, what's contributing to these denials that are occurring during the service is the key to unlocking where we need to make changes. Excuse me 1 minute. Okay. And then post-service, the post-service phase. This is where the real focus is on effective claims processing. It's recommended that hospitals review claims both mid-cycle and before the claim is sent to the payer to look for errors and to make appropriate edits. So you don't wait till the very end. If possible, edits should be customizable to the payer, since each payer has different requirements on claim forms. Review edits on an annual basis to look for inefficiencies. It's important to keep monitoring what those edits are doing for you. And also, this is where your denials team can really come into play and really prove to be valuable. Involve the front, middle, and back end departments, so have a multidisciplinary denials team. Track denials, being sure to capture the payer, the denial type, etc. And then this will allow you to analyze the trends and focus efforts and appeal those denials. Excuse me for 1 second. Sorry about that. I have a frog in my throat. Prioritization is so important. Once leaders identify where problems are occurring, then they should prioritize those areas that will have the greatest impact on their hospital's bottom line. So we already mentioned this. Also, drill down. It's very important to understand, not just look at that high-level denial reason, but dig into it. Figure out, are there specific payers who are involved in this particular denial reason more often than others? Are there service lines that are perhaps having repetitive issues? Are there departments that are contributing? Are there even individual physicians, some of your proceduralists, who are continuing to have issues, so that you can actually get to the point where you can have critical conversations and make some improvement. And overall, you need to understand the dollar impact of inefficient processes or errors in these various areas. Ongoing analysis is absolutely the key, and those of us who work in hospitals and are used to process improvement know this, that this should be a constant process, just as with all of our performance improvement processes. A data-driven process includes a discipline to measure and monitor, make changes and adjustments to the process, and then measure and monitor some more. It really never ends. And share the data. This is something that we all believe at MoreCare believe so strongly about. The data really should drive your processes. While hospital leadership might have an understanding of the resources that are being wasted and the revenue that's being lost in chasing these denials, and the case manager might even have a strategy that she thinks could improve the performance, the staff, the frontline staff, rarely if ever see a report on denials. Very few people in a hospital know what's actually going on in terms of denials. They don't know what the denial rates are, and in many cases, they're not being asked for input on how they can improve processes. Teams need access to reports in order to build action plans for improvement. If you have the data and teams are developing action plans, and if they're looking for improvement opportunities, they will find ways. They'll be able to reduce length of stay and cost, and they'll be able to help improve quality and avoid denials. And remember, the best way to improve the denial rate is to prevent those denials from ever occurring. As verbal or written denials are issued by payers, the denials are, this is an example, I'm sorry, of a workflow, an automated workflow. And this is I'm just speaking from our experience here at MoreCare, but I'm sure that a lot of the systems operate in the same way. I can tell you with our solution that it starts with the denial details being posted or entered into MoreCare. We have a very robust rules engine that combs through the data and makes assignments and serves up the data via work lists for each individual based upon their role. Denial reviews then are like the records that keep track of the denial, and they're very rich with key information. They provide easy access to go in and be able to understand the various nuances that were involved, the various parties that came into play. And of course, we have a library of standard reports. We also have multiple options for ad hoc report writing, and we have interactive drill down dashboards. All of these results in delivering actionable information to your organization. This is an example of our interactive denials dashboard, one of our dashboards here at MoreCare. And this is something that we actually really take a lot of enjoyment in. We work really hard with our customers to be able to provide them with the information that they need, visibility into their processes and what's going on. So this is just a picture. I'm not gonna drill in and do any kind of a demo, but just to give you a view for being able to trend your denials, both open and closed, over time. And in our dashboard, you actually can drill into any of these time periods and really understand the specific details beneath. We also can track our denials by insurance type, which is very important, as we said, to be able to understand who your major contributors are for your denials, and then drill down to the specific patients involved, and again, the details of their care. Services, as we said, who are your high volume services, and are your high volume services resulting in your high volume of denials, and being able to really have that view as to where you need to have conversations, where you might need to focus some effort to provide some education and to shore up your processes. And then of course the denial types over here, drilling down not only from the type down to the very specific reasons and understanding how those are trending over time. Are my level of care denials tracking up or down? How am I making improvements, etc. So, in summary, what we wanted to talk about today was managing denials, how denials are costing you money. We want to discuss a recommended process for leveraging information to better understand denials, and then how a denials management system, such as MoreCare, can provide value to your organization. In closing, we want you to ask yourself this: how could this impact your bottom line? Are you all experiencing cash flow restraints or budget concerns? I'm sure that the answer is probably yes. We provided earlier an example of a hospital that was paying over $165,000 a year to manage denied claims through a manual process. What hospitals are currently paying for the management of denied claims could pay for an automated solution, which would not only impact your bottom line, but could also improve employee and patient experience. So it might not be as daunting as you think. There's, something called return on investment, ROI. Yes, you invest in a system, but how that returns and how that saves your organization money over time is extremely valuable and usually far outpaces the initial cost of a solution. Well, at this point, I think I'd like to see if anyone has any questions. Colleen?
Thanks. Yeah, thanks so much, Beth. I do have a couple that came across. First one I have is at my facility, the UR department handles concurrent denials and our billing office handles retro denials. Does your system allow for both groups to document denials?
Yes, actually it does. Our system allows for multiple users to access the system under a single license, and then we have a really strong security structure and model so that different groups with different work responsibilities have access to different levels of information within our solution. So yes, it can allow, for instance, your revenue cycle denials management people to have a different level of access into denials than your frontline care managers who are capturing concurrent denials. Absolutely.
Thank you.
Mm-hmm.
I have another one. The majority of our denials are short stay technical denials, like authorization not received or service procedure not approved or wrong insurance billed. Do you have a recommendation for avoiding these type of denials?
Mm-hmm. Yeah. Well, again, that gets back to tracking that information and then really digging in and looking at, where your high volumes are and what your root causes are. We do suggest monitoring, for example, with your short stay, your observations or your outpatients in addition to your inpatients. So don't just focus on your inpatients. You want to absolutely be following those OBS and outpatients as well, making sure that insurance verification is occurring, making sure that every procedure is pre-certed. And in our system, we have on those work lists that we mentioned, we also have conditional formatting that can very quickly visually alert someone working a denial to or the case managers to potential deficits that could lead to a denial. So if something hasn't been captured, we can turn, pardon me, one of the fields, the corresponding field, yellow or red on a work list, which tells that case manager, oops, I got to do something quickly before this patient leaves so that we can avoid a denial. So we use the tool to kind of inform and prioritize their work.
Fabulous. Thank you.
Mm-hmm.
Well, thanks again for this presentation, Beth, and thank you to all of our attendees for joining us today. As a reminder, you will receive a link to the recording this afternoon. MoreCare is also going to reach out with a presentation for all of our attendees. If you're interested in any of our past webinars, those are also available to view on demand. You just need to navigate to them through the NRHA partner website, which is nrhapartners.com, and click on the Rural Health Learning Center. Before I close out the webinar, is there anything else you'd like to impart on us, Beth?
Well, we again would like to say thank you guys so much. We would absolutely love to talk with you about how we might be able to provide value to your organization. You'll see here that our website is www.morecarellc.com, and myself and my colleague Tina DeWeese would love to engage with you all and have further conversation. That's what makes our day. So please don't hesitate to reach out and to follow us on LinkedIn.
Thanks so much. And then also a reminder, there will be a survey for this webinar that will pop up right at the very end. So please take the time to complete that. We do look at all of the answers. Thanks again to everybody. Enjoy the rest of your day. Stay safe and healthy. Bye-bye.
Thank you all. Bye-bye.